So next we have a presentation from Respiri with the ticker code RSH, a company leading the way in the development of innovative eHealth solutions. To tell us more, I will hand you over to the CEO, Marjan Mikel.
Thank you very much. I thought what I do today is focus on providing an overview of the company, but really focusing on one of the pivotal moments in the company's history, and one that's very tactical but important to us, and that is the launch in the US marketplace. We received FDA approval in the marketplace in March last year, and it is a huge opportunity for us. As background, Respiri is a medical device and SaaS company that focuses on respiratory medicine. Our revenue streams are generated by a business model that looks at selling devices itself, the wheezo device here, and also the SaaS, monthly SaaS fees that come along with that allow physicians, hospitals, payers, and patients to access the app that's required to make the device work. We launched in Australia in October 2020. And as we've always said, Australia was our little sandbox, and the objective of that was to learn as much as we possibly can from the experience here. And some of those learnings were very, very positive for us. Others were a little painful, but nonetheless, one of the things that came out of the whole experience was the need to accelerate our launch in the United States. And I'll get into more about that in a moment. And it's not just about the fact that the US is 15 times the size of the Australian marketplace. There are many other market parameters that make it so attractive for us. As background, asthma as a disease state is the third largest to afflict the human race, third only to cardiovascular and diabetes. It affects about 350 million patients across the globe. 3 million here in Australia itself, and over 26 million in the United States. So it is a huge marketplace and grossly underserved. Yet today, when a patient leaves the care of their physician, that physician and that patient have absolutely no transparency around whether or not the intervention, the prescription that the doctors put together for the patient is in fact working. And unfortunately, that does lead to exacerbations, does lead to attacks, and does lead to deaths. 1 in 10 patients in Australia and across the globe will end up in hospital because of an asthma attack at least once in 12 months. And even in this great country of ours, 300 people still die of asthma every single year. So clearly something's not working. The US market is a market that we launched in December last year, and we were lucky enough to spend a month over there just recently. We had to accelerate all that. We're 9 months ahead of our scheduled launch because it's so important to us. And as I said, what I'd like to do now is just give you all an understanding of why the US is so important to us. Now, it is a huge physician-led and reimbursed marketplace. That's not the case here in Australia. The charter of Medicare in Australia is for diagnosis and treatment. We have a wonderful healthcare system in this country. Unfortunately, it doesn't cover remote patient monitoring and does not cover preventative medicine. So it's out of pocket. Important to understand that we are working through a bespoke model through remote patient monitoring partners. And they are particularly excited about adding wheezo to their portfolio because they're the only ones that have it. So there are no pricing discussions necessarily that happen with their customers. Those customers being doctors, ACOs, accountable care organisations, that stands for, conglomerates of hospitals, etc., that deliver healthcare, and also doctors. Now, we have just come back from the US, and wheezo has been extremely well received by payers, physicians, and that was, as I said, confirmed at the American Academy of Allergy, Asthma and Immunology, which was held in late February. As I said, we do have FDA approval, so we are already selling product. And in the first 2 months of sales in the US, we've just sold just under $200,000 worth of wheezo in that marketplace in a very short period of time. Important note that in the US, asthma accounts for about $82 billion in financial burden on the healthcare system in that country. So again, something is clearly not working. And when we talk to stakeholders, part of that problem is that unlike other disease states like cardiovascular, diabetes, today there is no way for a patient to be monitored by their treating physician in a remote setting. And wheezo handles that situation. So it is reimbursed at the moment, and As I've said, we can demonstrate to doctors that the presence of wheeze demonstrates that there is a significant reduction in lung function as it's measured by spirometry or FEV1. So if you can hear wheeze, your lungs aren't working properly. So we're also attending a major conference in the not too distant future, in fact, next month. And that conference is with the National Association of Accountable Care Organisations. So these are a combination affiliations of hospitals, pharmacies, payers that basically come together to provide a one-stop shop when it comes to helping patients with conditions such as asthma. Important to note, in the month that we were in the US, we secured our first reimbursement-led remote patient monitoring customer, and that was with Michigan Children's Hospital. So that happened in a very, very short period of time. And as I said, together with our partners, we've got nigh on 100 qualified leads, which we're following up again, and we'll be spending quite a bit of time in the US moving forward to take advantage of these things. As I said, in the US, there are over 26 million patients with asthma. That's 1 in 13 people. Every year, 1.6 million patients end up in a emergency ward. The cost of that to the system is about $8,000 US. 1 in 20 patients have COPD. That's just shy of 900,000 ED visits, but they're a lot more expensive when it comes to the way they're treated. Now, remember, this is just ED visits. It doesn't take into account if they get admitted into the hospital wards. In this instance, it's just shy of $28,000 every time a patient turns up to a hospital or a hospital's ED unit. So really, respiratory disease places a significant burden on the healthcare system, not just in the US, but everywhere. I thought I'd focus on one of the reasons we accelerated, some of the reasons we accelerated our launch in the US. Albeit a 15 times size market to Australia is very attractive, but far more importantly, a lot of the headwinds that we faced here in Australia do not exist in the market dynamics in the US. For example, wheezo is reimbursed in the US marketplace. It is a physician-driven situation over there, which it wasn't here. Important to note that the US is one of the only markets in the world where it's the actual doctor that gets reimbursed for handing out one of these to their patients. So they are financially incentivized to provide this to a patient above and beyond the care that they need to be providing. We have remote patient monitoring partners, 2 of them, high quality partners, and I'll get into who they are in a moment, that have established relationships with not just physicians, but also payers and the like. Important to note that our partners get remunerated on the annuity streams that we generate on a monthly basis. So our SaaS platforms that they receive as a fee for service for providing the devices to the doctors. In the US, the pricing of wheezo is significantly higher than it is here in Australia, and we can generate significant revenues for that, and a margin of roughly about 30% at the moment. The annuity streams, depending on the sort of service that our partners are providing, are somewhere between $5 and $20 US per month for us. So that's on top of the device sales. Important to note that the private health insurers in the US do feel the pain because they cover the cost of the entire healthcare delivery. It's not like here in Australia where the private health insurers don't cover anyone that's admitted into a public hospital. In Australia, if you're crook, you end up in a public hospital. So if you've got an asthma attack, you end up in a public hospital because that's best quality. That's not the case in the US. And as I said, at the end of the day, the market is a huge opportunity for us. I just thought I'd take a moment to demonstrate the financial benefit that physicians get with every single one of these devices they hand out. At the moment, there is nothing available to pulmonologists to really take advantage of the remote patient monitoring CPT reimbursement codes. Most of the work that's done in that area is in cardiovascular disease, so they're pretty excited about having an opportunity to provide these wonderful services to their patients and get remunerated for them. So fundamentally, every time a doctor hands out one of these things, they can earn up to $12 or just shy of $1,300 US, that is, a year per patient. On top of that, if they then take into account the chronic care management CPT reimbursement codes, that's another around, let's call it roughly $1,000. So for each patient that they potentially put on wheezo, they could make $2,000 a year. And important to note that in the US, the services around wheezo and patient interaction can actually be outsourced by the doctor to remote patient monitoring organisations, like those organisations that we partner with, which we're very excited about. I thought I'd take an opportunity. We had a wonderful time at the American Academy of Allergy, Asthma and Immunology in late February. And there's a list of organisations, hospitals and the like that we had very extensive discussions, numerous discussions during the conference, and have been asked to come and prepare an assessment of wheezo for them to take to their necessary decision makers. So we're very excited about what this is happening. We've already had quite a number of additional follow-up meetings to this. And as I said, everything's looking very positive because, as I said today, for these institutions in asthma and COPD, there is nothing available where they can provide patients with remote patient monitoring to help them understand whether patients are heading towards an attack and stop that from happening. This is what this device does. They're also very excited about how easy this device is to use. That was one of the things that really came across very strongly, because currently the way they diagnose patients is typically with a questionnaire, so it's very subjective. And to work out lung function, they use spirometry. And the instruction to patients when they're using spirometry by a doctor is typically something along the lines of, I want you to exhale until your lungs come out of your mouth. That's how difficult spirometry can be. And if you look at children and the elderly, that's just not going to happen. This device is normal tidal breathing, records the breathing, Bluetooths it to the phone, up into the cloud, and it's real information in real time from the real world that the doctor gets to get their hands on. We're also very excited. We were approached out of the blue by a major pharmacy group in the US to do an in-store pilot for wheezo using the flexible savings account and the health savings accounts, which basically are accounts that are fed by remunerations of companies for patients. And basically what it is as monies set aside for patients to use when they're out of pocket for a particular healthcare situation. So this would eliminate patients needing a copay in the pharmacy setting in the US, unlike the situation here in Australia. So as I said, we're talking to a number of major insurers on the West Coast, and they've been already evaluating wheezo for some time now. So we're very confident of getting some positive results from that in the next few months. And as I said, the size of these organizations, they cover between 900,000 and 5 million lives. And as I said, there are a number more that we're actually working with at the moment. Important to note that in the US as well, apart from reimbursement, there are what we call the Federal Communications Commission's grants, which are made available to those areas that are less fortunate than others when it comes to healthcare provision. And these are typically around about $1 million per institution. The United States Department of Agriculture also does these things because they are responsible for helping make sure the people who are feeding the US are in fact being looked after when it comes to healthcare. So we have quite a number of grants that have been submitted in for wheezo through one of our partners, and we expect to start seeing some results from this particular process in the next month or so. One of our healthcare partners is Access Telehealth. As I said, they've secured our first RPM wheezo customer in the Chicago Children's Hospital. They commenced promotion of wheezo in mid-January, so it hasn't been that long, and we're making some great traction. The important thing from our perspective is that they also have a patient engagement model that as I said, doctors can outsource that particular task to them. And it is very similar to the model in the US to what we do here in Australia, or did here in Australia, with the remote asthma monitoring program, where it was physician-led and had a group of asthma nurses engaging with patients to help them better understand how to manage their conditions. In Australia, it's not reimbursed. In the US, it is. As I said, they attended they attended a RPM conference in Las Vegas, and again, we're still working on the number of very positive leads we've got from that. They funded and attended with us the American Academy of Allergy, Asthma and Immunology. And I spoke about that at some time. And it is important to note that it is a very cost-effective way for us to actually enter the US marketplace, given that our partners are very much committed to helping fund much of the marketing that goes on in that particular country. So we've had initial orders finalized, and as I said, they're a very highly experienced and credentialed team. Very, very pleased to be working with them. mTelehealth is our other RPM provider. They actually commenced active promotion in mid-December. As I said, they've already purchased just shy of $175,000 in revenues in the first 2 months. They've undertaken a major campaign for wheezo with their customers, and the response has been unprecedented. And that's not what I'm saying, that's what they're telling us. And we can honestly say that our morning shifts where we talk to our customers in the US, and our time in the US was very, very busy because of the work and leads that this had generated. They're actively engaging with 30 plus customers, including those organizations that I've just put there. So we're working right across the gambit of people who have a vested interest in making sure that patients with respiratory disorders get the necessary care and monitoring when they're not with their physicians. And in doing so, minimize the impact on the healthcare system. So they've been in business for 11 past years. So I just thought I'd finish where I started. It's a huge marketplace that's physician-led, the US. We've got best-in-class remote patient monitoring partners. As I said, wheezo has been very well received by payers, physicians, and unprecedented when it comes to the response we've got from that. We do have FDA approval. We're already selling in the US. As I said, the burden of respiratory conditions in the US is huge, just shy of $82 billion. Important to note that we do measure a physiological parameter, so we qualify for reimbursement right now, and that's clearly the case, as you can see. We do know that for wheeze to manifest, lung function has to be compromised, and that is really important because that gives doctors confidence in the new technologies that we're providing them with. And as I said, we've got plans moving forward to make sure that we take advantage of some of the other forums that we have in generating more leads for the organization. And as I said, the next major one will be with the accountable care organizations, which are major groups that really do provide a integrated healthcare solution to patients. And as I said, we've already secured our first remote patient monitoring customer in the Michigan Children's Hospital. And we're really well placed with a pipeline of opportunities that keeps us pretty busy moving forward. So we're looking forward to being able to announce some significant partnerships and customer engagements that will lead to significant revenues moving forward. So thank you very much for that, and I'll hand over.
Marjan, thank you for the great presentation. Unfortunately, we have run over time, but I would encourage any webinar attendees that do have questions to reach out directly via the contact details on the bottom of the ASX releases. But thank you so much for joining us.
Thank you.